The United States is in the midst of nothing less than a crisis created by illegal immigration, soaring education costs, billions spent on illegal aliens in our prisons, displaced American workers. Now, in the latest edition of the Journal of Physicians and Surgeons, Madeline Cosman, a medical attorney, declares illegal aliens are responsible for the closing of dozens of emergency rooms and are constituting now a threat to our public health. Madeline Cosman joins us tonight from San Diego. Good to have you with us.
Thank you. It's a pleasure to be here.
Madeline, the issue of the diseases first that are being brought into the country because illegal aliens obviously not going through our ports of entry are meeting national health care standards, are being provided health care at our ports of entry. What are the diseases that are most concerning to you?
Multiple drug resistant tuberculosis is one of the most significant, and the Chagas disease, dengue fever, polio, hepatitis A, B, C, certain diseases that we thought we had vanquished years ago are coming back, and other diseases that we've never seen or rarely seen in America because they've always been the diseases of poverty in the third world are coming in now.
Are we, in your judgment, are these diseases at this point at such a level that they constitute a threat to the national public health?
I think yes.
And in your judgment, what should be done?
Well, I actually recommend very strong medicine, and I'll give you an acronym, CRAG, C-R-A-G, and I would recommend first closing the borders and deporting illegal aliens, but welcoming legal aliens, and R would be rescinding the citizenship of anchor babies, which your audience doubtlessly knows about. And A is aiding and abetting illegal aliens is a crime. We should punish it, meaning anyone who hires illegal aliens. And G, grant no new amnesties. And when you say close the borders, quite literally, you mean to say that to establish border security, obviously you would encourage legal immigration and continued trade across those borders, but under the controls of the United States government. Imagine that, the U.S. government actually having control of borders. Would this be enough, in your judgment, to deal with this crisis that you see at hand? It would and it would not. That is, it would prevent the illegal aliens from coming in, but it would not actually prevent the problems that we're having with the illegal aliens who are already here, about 20 million strong. We have a terrible, absolutely vicious law called EMTALA, the Emergency Medical Treatment and Active Labor Act, which is really the culprit that requires every emergency room and every physician of an emergency room to treat illegal aliens for free.
And the costs of those, well reported. The issue, it seems here, as we try to wrestle with this crisis, in some ways almost a silent crisis, because our elected public officials are loath to deal with it, although that is changing. The nation, that is people who make this country up, are keenly aware of it. How are doctors, physicians, public health officials responding to your report?
Many are responding with great enthusiasm and gratitude that I've had the courage and the candor to tell the tale. Others have actually been surprisingly in denial. In California, Lou, we have had 84 hospitals close because they have, in essence, gone bankrupt because of treating illegal aliens and others, and 50% of all the treatments are unreimbursed. Even physicians in those emergency rooms don't fully get the point that by being compassionate and generous and gracious, they are in essence destroying their own livelihoods as well as their own hospitals.
Madeline Cosman, we thank you for being here. A provocative, interesting, and important report. Thank you.
Thank you.
Evidence tonight is building against the so-called benefits of outsourcing.